This week in the Mount Sinai Spotlight, researchers discuss a link between gestational diabetes and postpartum depression and how to stay healthy this flu season.
We're definitely seeing an uptick in flu across the state and across the city. Influenza vaccination is a huge thing. It protects you, and the more people that get it, it protects whole communities. That's the most important thing. The second thing is hand washing, frequent hand washing. Anytime you sneeze, there's droplets that come out of your respiratory tract, and those can be infectious to other people. So the best practice is do the vampire sneeze, into your elbow, into your sleeve. The viruses that cause influenza live less time on clothing than they would on a hard surface. People often avoid getting the vaccine because they associate often getting the vaccine with getting sick. And so they think the vaccine causes illness, and it absolutely doesn't. It's just that the months of the year that people are being vaccinated, there are a lot more other viruses out there.
We found that a history of depression was the single greatest predictor of postpartum depression. In fact, if a woman has a history of depression, she's 20 times more likely to experience postpartum depression than a woman without a history of depression. We also found a relationship between diabetes and postpartum depression, specifically gestational diabetes. A woman with a history of depression and gestational diabetes is now 70% more likely to experience a postpartum depression. Most clinicians consider these two very different disorders, when in fact our data shows they should really be considered together. What makes our study so unique is that we can intervene before the woman has a child. The practitioner can say, based on your medical history, we think there's a possibility that you'll experience a postpartum depression.